Howdy, my name is Nia Gaddam, and I did my psychology and film project on the movie Split. So the main character's name is Kevin Wendell Crumb, and this movie is set in modern-time Philadelphia, where it follows Kevin as he kidnaps 3 teenage girls who later see his various personality states emerge. So I diagnosed Kevin with dissociative identity disorder, or DID, which is the presence of 2 or more distinct personality states. So these states will take complete control of all behavior and actions, and it often leaves significant memory gaps. And there already is a therapist in the movie, Dr. Fletcher, who diagnoses Kevin's DID and observes 23 separate personalities, as well as a 24th one that is yet to emerge. Previously referred to as multiple personality disorder, DID was established as an official diagnosis in the 1980s. So because of this relative recentness, there are still a lot of parts of the world that don't acknowledge it as a true diagnosis, and especially cultural and religious groups, they would rather see this as a supernatural or demonic phenomenon. And so some stigmas included would be tying these patients with violence, hallucinating all of these personalities, or thinking that this condition is very rare and unlikely for a person to have, when in reality 1 to 3% of the population is afflicted, and these individuals aren't as dramatic and psychotic as a lot of movies like to portray. Instead, these transitions can be very subtle, nearly imperceptible, and so it's a lot more downscale than the media often shows. And one symptom I saw in Kevin was unawareness of the other state's presence. So as soon as the beast goes to Kevin immediately asks, "What did I do?" For the past 2 years, he had not been conscious of anything that he had done. And another symptom would be clashing streams of consciousness. So after Casey calls out Kevin's full name, Kevin Wendell Crumb, his many personalities eventually surface as they're trying to combat each other for control, which is seen in the real world. Patients do note that they can hear these different personalities in their head, oftentimes. And a symptom not displayed would be insomnia, which is habitual sleeplessness. And it could be really any sleep-related issue, sleep deprivation, sleep paralysis, recurring nightmares, but it is shown that sleep is associated with DID. And some treatment plans I would propose would be free association, which would be the sharing of all thoughts without filter. And this could allow Kevin to really dig into that past trauma. So he himself had suffered abuse from his mother. So being able to talk about that and figure out how that makes him feel, I think would keep it from being so stifled and reduce these transitions between all these different personalities as he's trying to cope with that. And person-centered therapy, so specifically unconditional positive regard, listening to him with warmth and empathy without judgment, I think could really help narrow down what he likes about himself so that we can narrow down to his true core self. And cognitive behavioral therapy, so specifically cognitive restructuring, which would be pinpointing and modifying maladaptive thoughts, I think could really help figure out what is causing these personality switches, what makes them want to cause harm, and instead redirecting these thought pathways to something more healthy and normal. And ethical concerns, there aren't really any. It could just be resurfacing this tremendous past trauma could cause significant distress. But again, from an ethical viewpoint, this doesn't cause much alarm. And barriers to proper treatment could be a lot of those stigmas we discussed before. So blowing off these personalities as hallucinations, dismissing him as violent and locking him up without giving him psychiatric help, or just general difficulty in pinpointing the symptoms and making a diagnosis. And so for a broader perspective, I do think that as entertaining and captivating as this movie was, it did dramatize DID beyond what it normally is. It makes patients come off as inherently violent. It fails to acknowledge the internal struggle and self-harm that many of these patients actually do endure. And it can incite a fear of DID and enable others to disacknowledge the trauma and difficulty that these patients themselves have to deal with.